Hello anatomy students. Today we're going to review the functions of the skin, and we're also going to learn about some disorders of the skin, namely different kinds of skin cancers and burns. But first, let's take a look at some of the functions of the skin. I just have to flip back to my first slide. You can see that I've got a number of them listed here, and they're pointing to various places in this chunk of skin where they are going to occur. So the first function is thermal regulation, which means that our skin is going to play a role in maintaining a balanced temperature inside of our bodies. This is called thermal regulation, and one way in which the skin does that is by producing sweat. And when the sweat pools on the surface of our skin and evaporates, it has a cooling effect. But the skin also contains a number of blood vessels, not just the capillary loops that are found in the papillary layer of the dermis, but there are also some larger blood vessels that are found in the subcutaneous layer. And as they dilate, they are going to release heat, which is inside of our blood, and allow it to dissipate through the skin and then out into the environment. And our blood vessels can constrict also, and as they constrict, they kind of shrink further away from the surface of our skin, thereby keeping the heat that is contained within the blood closer to the core of the body, closer to our vital organs. So that's how our skin functions to maintain thermal regulation. It's also a blood reservoir, which basically means that our skin is going to have these blood vessels that's going to carry a certain percentage, 10% according to your slide, of blood flow in a resting adult. Our skin is going to provide us with protection. So we have cells that produce keratin, and the cells that contain keratin are called keratinocytes. And these hardened, tough cells are going to protect us from invasion of microbes through the surface of our skin. As epidermal cells migrate from the stratum basale all the way up to the stratum corneum, they're going to start to lose their cytoplasm, and they're going to be covered with these glycolipids. These glycolipids are going to inhibit evaporation, so it's going to help to keep our skin nice and moist, as does sebum, which is the secretion that comes from sebaceous glands or oil glands, and that's going to help to maintain the surface of our skin as well. The sebum and the sweat together are going to have some antimicrobial properties because they both lower the pH of the surface of our skin. And then finally we have intraepidermal macrophages, and these are monocytes that live in the layers of our epidermis, and they will alert the immune system to any invasion that occurs by antigens from our environment. Our skin is also going to allow water to evaporate from our sweat. That's going to help us to remove heat. Our sweat is also going to contain some waste products like ammonia and urea and salts, and even a little bit of carbon dioxide. So our skin is going to perform a function of excretion. We are able to also absorb fat-soluble vitamins through our skin, and even some drugs, and unfortunately also some toxic chemicals. So if any of you have ever doodled on the back of your hand or written the phone number of somebody on your hand, you know that it doesn't stay there forever. If you don't wash it off, that ink can be absorbed into your skin. And then finally, our skin is responsible for helping our bodies to synthesize vitamin D. So when ultraviolet radiation strikes a precursor to vitamin D, it is going to activate that precursor into vitamin D. Then the liver and the kidneys are going to modify that vitamin D in order to form a hormone called calcitriol. And calcitriol is going to stimulate the absorption of calcium from the gastrointestinal tract. That's what GI means. It's also going to do a few other things, which I want to show you on our next slide. So the calcitriol is going to stimulate our skeletal system to take up calcium from our blood. So calcitriol is going to help to strengthen our skeletal system. It's going to stimulate the calcification process, or the deposition of calcium salts around the collagen that's found inside of the matrix. Calcitriol is also going to stimulate the urinary system by directing the kidneys to reabsorb calcium into our blood. So it's going to lower the amount of calcium that is excreted in our urine. Calcitriol is going to stimulate the digestive system to absorb calcium from the food that we eat, which is what I mentioned on the previous slide. And it's also going to stimulate the endocrine system by stimulating cells of the parathyroid gland to stop making parathyroid hormone. You see, when parathyroid hormone is in the blood, parathyroid hormone tells the bones to start breaking down the tissue in order to release calcium into the blood, thus raising the blood calcium level. But that's not that's not the action that calcitriol wants. So calcitriol is going to inhibit the production of parathyroid hormone so that the calcium gets stored in our bones instead of being released into our blood. And so this is an important way in which our integumentary system helps our body maintain homeostasis, at least calcium level homeostasis. All right, so one of your objectives is to understand how the aging process affects the skin. And so when one gets older, one thing that you will unfortunately start to see are some more wrinkles on the forehead, around the eyes, maybe even like those parentheses that start to form here from the corners of the nostrils down. And the reason why this happens is because as one gets older, the number of collagen fibers are going to decrease. And the reason why is because they're aging. And so they start to fall apart. They become more disorganized. And along with the collagen fibers weakening, our elastic fibers are also going to weaken and lose elasticity. It's kind of like an old rubber band, right? It might stretch out, but then it doesn't recoil as well as it used to when it was a nice new rubber band. Also, the fibroblasts, which are the cells of the dermis that secrete the monomers that make the collagen, their numbers are going to decrease. And so you're not going to have as much collagen or elastic fibers. And so all of that together is going to promote the formation of wrinkles in older people. Also, as one gets older, the immune response that's found inside of the skin is going to diminish, which basically means that elderly people are more prone to skin infections. And the reason for this is because the epidermal dendritic cells, which is synonymous with the intraepidermal macrophages, so their numbers are going to decrease, thereby leaving the skin and the body less protected than it was when the person was younger and when those cells were in more abundance, greater abundance. You may notice if you just observe the skin of elderly people, it seems papery and very thin. And the reason for the paperiness is that the skin is starting to dry out. The number of sebaceous glands starts to diminish, which means that the amount of natural oils that are found on the surface of the skin will also begin to diminish. And the skin appears to be almost translucent, where you can see the different blood vessels much more clearly. And this is because the walls of the blood vessels thicken, and because adipose tissue that's found in the subcutaneous layer becomes lost. And so you're missing that the padding as you get older that's found underneath the dermis, and so you're able to see a little bit more of the structures that lie below it. And then finally, if an elderly person gets a bruise or gets a cut, it takes a longer time for those injuries to heal. And the reason why is because the migration of the cells in the stratum basale is going to slow down. So you're not going to have as swift a turnover of the stratum corneum as you do when you are younger. And because of that, it takes longer for injuries to heal. And so that is those are the effects that aging has on our skin. So the next slide is going to commence our talk about skin disorders. And like I said, we're going to focus on different skin cancers and on burns. And skin cancer is the most common cancer that is found in humans. And usually this is going to occur due to overexposure of ultraviolet radiation. So people who sunbathe a lot or who work in the sun a lot, they are going to be overexposed to ultraviolet radiation and run the risk of contracting skin cancer. But it's not just UV radiation. It can also be just repeated irritation of the skin or of an area of the skin by infection, and also repeated trauma or injury to a certain area of the skin that seems to also be a cause of these skin cancers. There are 3 types that are considered the most common. There are others besides this, but these are the 3 that we're going to consider. The first is basal cell carcinoma, the second is squamous cell carcinoma, and the third is malignant melanoma. And so out on this slide, what we're looking at here on the left-hand side is the acronym ABCDE. And we're going to look at this more closely because this is what you should be using if you think you might have a malignant melanoma. So we'll talk about this in more detail on the next slide. But A refers to asymmetry, and B refers to border, C refers to color, D refers to diameter, and E refers to evolution. And so in a normal nevus, or a normal mole, as you can see in the picture, it is symmetrical. It has a nice clear border that is even. It has a uniform color. It's about the diameter of a pencil eraser, and it hasn't changed. And I know this because it says, the picture that I grabbed it from online said that it was a normal mole, which means that it hadn't gone through any kind of evolution. And so those are the things to consider when you're looking at a mole on your body or on somebody else's, to kind of give you a predetermination of whether it could possibly be cancerous or not. But I just wanted to demonstrate that with a normal mole. But now let's get into talking about some different kinds of skin cancer. So the first kind is called basal cell carcinoma. It's going to originate in the cells of the stratum basale. And what happens is that the cells are deprogrammed from making keratin. So they're not keratinized anymore, and so they're going to start to divide. And instead of migrating up towards the stratum corneum, where the keratinized cells are, they're going to start migrating deeper into the dermis. This kind of carcinoma is often found on sun-exposed areas of the face, and it is slow growing. It's not going to spread very easily, and so as long as it's removed as soon as possible, then the chance for being cured of this certain kind of carcinoma is very good. Our next type of carcinoma is squamous cell carcinoma, and this kind of carcinoma arises in the stratum spinosum. This kind of cancer can be found anywhere on the body, not only in places where the skin is exposed to excessive ultraviolet radiation. But this kind of carcinoma is different from basal cell carcinoma because this kind is going to grow rapidly, and it will metastasize or spread to other tissues extremely quickly as well. So this needs to be removed as soon as possible. But you can be cured of this as long as it is removed early. All right. And sorry, my little picture there, I had the animation on wrong, but I'll show you that again. Our final type of carcinoma is malignant melanoma, and this is a very rare form of skin cancer. However, it's deadly. It's very difficult to treat. This is also going to originate in the stratum basale, but not by epithelial cells. It's originating in melanocytes. So when melanocytes are exposed, again, too much to ultraviolet radiation, their DNA can be damaged. And this is going to cause them to divide uncontrollably. And this kind of cancer is also going to spread very, very rapidly. And when it does, it goes to the lymph nodes and it goes to the blood vessels. And once it hits the blood vessels, it now has a highway to travel throughout the entire body. So if it's caught early, it can be treated with cancer, radiation therapy, chemotherapy, and some types of immunotherapy. And of course, if it metastasizes or spreads, then it is going to need further treatment as well. So those are the 3 different types of skin cancer that I would like you to know. And the next disorder of the skin that I wanted to talk about are burns. And there was one more thing that I did want to talk about here. I wanted to show you how to apply the ABCDE rules to a malignant melanoma. So I already showed you how to do that on a normal mole, but on a malignant melanoma, you can see that A, which stands for asymmetry, check. That's exactly what we have here. Like, you can't draw a line through this lesion and mentally fold it over so that the edges match. B is border, and as you can see, it doesn't have a smooth border. The border is kind of scalloped, and so you've got some indentations here, you've got an indentation here. It's not nice, smooth, and a straight line. C is color, and this is clearly not uniform in color. You have one part of it that is very dark. You have another part that's light, but it's got dark splotches on the surface of it. So the color is not uniform, which is a characteristic of a malignant melanoma. D is diameter. And I know it's difficult to tell from the picture, but the diameter is larger than the head of a pencil eraser. And then finally, evolution. Did it change? It seems to me that there was some kind of change here, because like the base of this portion is dark and the base of the next one is light. And so if the patient has noticed any kind of change in that lesion, then they would report it to their doctor. And so that's how to apply your ABCDEs to a lesion that you suspect as being a malignant melanoma. Okay, so back to burns. So I know that if you've taken a first aid class, you've probably heard of first, second, and third degree burns. Your book also talks about a fourth degree burn, so I added a slide for that here. So a first degree burn is the least severe kind of burn. It's where only the epidermis is affected, but the skin functions are still intact. Is it painful? Sure, it can be painful, but it will heal itself very quickly. A first degree burn is not characterized by any kind of blister. A second degree burn, however, is going to destroy the epidermis and also a part of the dermis, and fluid will start to collect between the epidermal and the dermal layers. And so that's what a blister is. And you can see on the picture there that the child must have grabbed onto something that was hot. He's got a blister that is extending the entire length of his palm. And as you can see in the graphic below the picture, the epidermis and the dermis are affected by a second degree burn. And so this burn is characterized not only by blisters, but also by redness, pain, and edema, which basically means that blood vessels have been damaged, and you've got some fluid leaking from those blood vessels into the surrounding tissue, causing it to swell, and that's what edema is. The accessory structures, the sweat glands, the hairs, they are not affected by a second degree burn. They are affected, however, by a third degree burn. And if I were to take a guess here, this burn looks like an electrical burn to me. A third degree burn is also known as a full thickness burn, and the reason why is because the epidermis and the dermis and the subcutaneous layer are all lost. And in the area of damage, the functions of the skin, which we went through at the beginning of this presentation, are also lost. The patient will experience numbness in the area. Why? Because the nerve endings have been damaged. And then you also have some systemic effects. So, if the size of the burn is great enough, you could have loss of fluids. You have now compromised the integrity of our body's covering, and so now infection is a risk. We have reduced blood circulation to the area because the blood vessels have been damaged. And again, if the burn area is great enough and if fluid loss is great enough, then urine production will be affected, as well as immune function, because you've probably damaged a lot of the immune system cells. And then that's going to contribute to the risk to infection too, because not only have we lost our protective barrier between our bodies and the environment, but now the immune system cells that are involved in protecting us are also gone. Now I want to make sure that you know this. On the next slide, I have a pretty graphic picture. So I just want you to know that before I switch the slide. I'm switching it now. I'll give you a 3 count. 3, 2, 1. This is a picture of a 4th degree burn. And what characterizes a 4th degree burn is the involvement of tissue besides the skin, the subcutaneous, and the subcutaneous layers. So what you see in this picture is a burn that a person received to the posterior aspect of their hands and fingers, and you can see that tendons have been affected, and there is some exposure of bone here as well. And so again, this is called a 4th degree burn because other tissues of the body besides the skin and subcutaneous layer have been affected. So patients who experience 4th degree burns will have to undergo some surgery, most likely some grafting, because and grafting is something that a patient with a 3rd degree burn will have to experience as well, because in both 3rd and 4th degree burns you have completely destroyed that stratum basale, and now you don't have stem cells to regenerate the injured area. Sometimes with a 4th degree burn, physicians are not able to fix the area, and so amputation may be necessary. So one way that clinicians are going to determine the treatment that a burn patient needs to have is by using something called the rule of 9s. You see, when a burn patient comes in, the number one thing that they are at risk for is infection. And so that has to be, the body has to be protected first. The next worry that a clinician has about a burn victim is the loss of fluid. And the loss of fluid, like I said, can really affect the kidneys. And if the kidneys shut down, then the rest of the body really doesn't have much more time, because the kidneys are the main organ to take away body wastes. And if those toxins start to build up in the body, then that's just going to wreak havoc on all of the systems of our body. And it would be questionable if a burn victim would be able to survive that. And so healthcare workers are going to determine how much fluid a patient needs to receive who's received a burn by something that's called the rule of 9s. And this is just a tool that they use in order to quickly determine the percentage, what percentage of the body has been affected by the burn. And then by that, they can calculate how much fluid the person is going to need in order to keep their vital organs working, in order to keep them alive. And so the anterior portion of the head and neck is 4.5% of the body, while the posterior portion of the head and the neck is another 4.5% of the body. So the whole head and neck is 9% of the body. One whole arm, sorry, you can't really see that, but one whole arm is 9%. 4.5% on the anterior aspect, and then 4.5% on the posterior aspect. So each arm is 9%. The anterior portion of the trunk of the torso is 18%. So even though it's not 9, 18 is still a multiple. So that's why it's called the rule of 9s. And so the anterior trunk is 18%. The posterior trunk is 18%. And then you have your legs. And so your anterior and posterior thighs, legs, and feet would be 36% in adults. So you can see everything listed on the left there. Oh, and then the genital area has its own percentage. It is 1%. But any burn that a patient receives in the genital area and also in the head and neck area, those are considered critical burns. And the reason why is because, especially in the head and the neck area, that could affect breathing in the genital area. The tissues there are just very sensitive and very delicate, and so even a slight burn can cause a great deal of damage. But other types of burns that are considered critical are circumferential burns, or burns that are all the way around the body. So burns that are found in those locations are going to be considered critical. And once again, so you can see that, you've got the rule of nines here. Now, I'm not going to ask you on a test, what percentage is the anterior part of the head? That's not it. What I want you to know is why healthcare professionals use the rule of nines. And the reason why they use the rule of nines is to determine how much fluid a patient has lost. So, so they use these percentages to calculate that. And the rule of nines is just an easy way for them to remember the percentages that are represented by each part of the body. All right, then, that's all I have for you in this presentation. I hope you enjoyed it. Thank you for watching, and I'll see you in class.